First aid is the provision of initial care for an illness or injury. It is usually performed by trained non-experts to a sick or injured person until medical treatment can be accessed.
The idea of a first aider is just the basic general knowledge of life-saving techniques, things for treatment of choking, burns, that type of thing. So just your basic medical knowledge. It doesn't take a lot. It's a couple of days, and it's very important that a lot of people do that, especially people who work with the public, people who work with children, that type of thing. Just that basic knowledge of how to stay calm, who to contact, what to do in the interim, it's very, very important.
One of the most commonly taught skills in first aid is CPR. It's performed in an effort to maintain some circulation until further treatment can be administered.
Cardiopulmonary resuscitation is a technique that has developed over years with the investigation of what happens to a patient during cardiac arrest. Cardiac arrest is the condition where the heart stops functioning correctly or as it should, and CPR is what we have created as an intervention to either reset the heart as such, or at least keep it going until the cause of the cardiac arrest can be solved. It's very important that people learn how to do it and understand why they're doing it. The whole action of compressing the chest therefore mimics what the heart is meant to be doing, so the blood would still keep going round and round in your body. So that's the basic idea. And then the ventilations, which is often seen as the difficult thing to do, those are in order to oxygenate the blood that is then going round and round in the body.
CPR involves performing compressions of the chest to manually circulate blood from the heart, and good technique is critical so the patient isn't injured further.
Firstly, you want to get your patient onto a flat, hard surface. You don't want to be doing CPR on a couch or a bed or something like that. Nothing that has got give. So a flat, hard surface, floors are perfect. You want to expose the patient's chest. You want to have a look. You want to open it up and you want to check. You need to make sure that they don't have a pulse. So you need to feel the pulse and make sure that they don't have a pulse before you start CPR. You need to inspect the chest. You need to find the middle line between the nipples. Sounds strange, but middle line between the nipples. And you need to take both your hands, place it on the chest in a nice firm position in the middle. The ratio is a 30-to-2 ratio, so 30 compressions and 2 ventilations. The important thing is not to waste time with ventilations and not to take longer than 10 seconds between ventilations and compressions.
CPR on an adult is actually quite different to performing CPR on an infant or young child. It's recommended that all parents are trained in baby and child CPR.
You need to press hard and you need to press fast. Hard, I mean by 2/3 of the patient's chest depth, so very hard, about 5 centimeters depth in. You need to press fast. You need to press at about 100 compressions a minute. There's a song that's Staying Alive. If you keep to the beat of Staying Alive, you'll be doing perfectly fine. You need to ensure that you get full chest recoil. So it means that when you press down, you need to make sure that you relieve a total amount so that the patient's chest can come up the whole amount. So not just pressing. You need to press up. And then the time limit. You need to make sure that you don't take your hands off the chest for longer than 10 seconds to give ventilations.
Other essential first aid skills include treating burns, managing the treatment of a wound, assessing a potential concussion, and the Heimlich manoeuvre.
The most important thing about choking is recognizing it early. Basically what happens is instead of swallowing the food, the patient will inhale the food. The Heimlich manoeuvre is then what has been developed in order to create pressure that will force that food particle back up again. The patients who are choking, holding their throat, they're coughing, they can't breathe, very, very difficult. So by placing your hands just underneath their sternum, between their rib cage, make a fist with your thumb facing the patient, and then you're going to take a flat hand and you're going to put your hand over, and then create a sharp upward and inward so that it creates enough pressure. This you might need to repeat 6 to 10 times. If the patient does become unconscious and you haven't managed to dislodge the particle yet, you would need to start CPR. That is obviously if the patient is not breathing and does not have a pulse anymore.
High schools, tertiary institutions, and some employers offer first aid courses free of charge or at a discounted rate to encourage the continued growth of education.
So with first aid, the general idea is to stay calm. Any situation, choking situation, cardiac arrest situation. So the most important thing is to keep themselves calm, to keep the patient calm, then to phone for assistance. It is important to know where you are what's wrong with the patient and give the correct information to the call taker. The call taker is not there, so you need to give as much information as you possibly can so that they can send the correct resources through to you.
First aid skills never go out of use. Help yourself and help others by taking a course and having those necessary skills in case of emergencies.